Hello viewers, I am Dr. Robiul. I work as a lecturer in pathology in a medical college hospital, and I am making this video for my students and also for you. Hope someone finds this helpful. Today's topic is infarction. In this video, first we will try to define infarction, then we will talk briefly about its examples, causes, types, morphology, and also we will briefly discuss about different factors affecting infarction. Okay, so let's begin. First question, what is an infarction? An infarction is the process of forming an infarct. But then you will ask, Dr. Robiul, what is an infarct? So now I will tell you the definition of infarct, but don't worry because I will explain this definition line by line afterwards. So as you can see, infarct is an area of ischemic necrosis caused by occlusion of arterial supply or venous drainage. So I am repeating the definition again for my students and then I will explain. An infarct is an area of ischemic necrosis caused by occlusion of either arterial supply or venous drainage. So now let's explain this definition. So what did we see in the first line? An infarct is an area of ischemic necrosis. Now what does this thing mean, ischemic necrosis? So actually we have two terms in these two words. One is ischemia and one is necrosis. What is ischemia? Ischemia means reduced blood supply to the tissue. Okay, so that is ischemia, reduced blood supply to the tissue. Now what will happen if we reduce blood supply to the tissue? Well, recall that the idea of supplying blood to the tissue was to give oxygen and nutrient to the tissue. So whenever there is diminished blood supply, the tissue will have less amount of oxygen and less amount of nutrient. So what will the tissue do then? First, the tissue will try to adapt, but when adaptation will fail, the tissue will start to get injured, and initially the injury will be reversible. But if this ischemia persists, then irreversible damage will occur to the cell and then the cell will die. And one of the pathways in which a cell can die is known as necrosis. Now I have separate video on adaptation and also on cell injury, and I will also add those description in the link below. But let's come back to today's topic about infarction. So now we know that infarction is the process of formation of an infarct. And what is an infarct? Infarct is an area of ischemic necrosis caused by occlusion of either arterial supply and venous drainage. And we also know what is ischemia. Ischemia means diminished blood supply to the tissue, and whenever there is diminished blood supply to the tissue, those tissues get affected, they get injured. First, there is reversible injury. That means if we can restore blood flow during that time, the tissue can recover, and then there is irreversible injury, and that is followed by necrosis. And that area of ischemic necrosis is known as infarct, and this process is known as an infarction. Now before moving on to the next topic, and that was the examples of infarction, I would like to mention an interesting point that one of my students asked during my classes. And that was, Dr. Robiul, we know that ischemia happens in a tissue when there is diminished arterial supply or whenever there is occlusion in the artery. But why does ischemia occur in the tissue when there is occlusion in venous drainage? And the answer is very interesting, and to answer that I have drawn an image in the lower part of the board. As you can see, this is a very diagrammatic image. So on the left side of the board you can see drawn in red is the artery. So this is the artery, blood is coming through the artery and then it's going to the tissue. In the tissue there is capillary, and through capillary oxygen and nutrients are getting transferred to the tissue, and metabolic waste product and carbon dioxide are returning to the vessel. And then there is the vein where the capillaries are draining. So we know that if we block the artery, the tissue won't get sufficient blood and there will be ischemia. But also look that if we block the vein, what will happen? This entire blood flow will get hampered, because from capillary blood used to flow to the vein. So if we block the vein, even if the artery is not occluded, it will also slow down the circulation. And initially there will be congestion, and later there can be infarction as well. So this is in short about the definition of infarction. So now that we have defined infarction and infarct, now we will move on to the next topic and mention some common examples of infarction that are clinically important. So the first example is myocardial infarction. Recall that the myocardium of our heart is supplied by coronary arteries and their branches. So whenever there is an occlusion in the coronary artery or their branches, that can result in ischemia or diminished blood supply to the myocardium, and that can later result in infarction. So that is myocardial infarction. Similarly, infarction can happen in our brain, that is known as cerebral infarction. Infarction can also happen in the lungs, that is called pulmonary infarction. And later we will see that pulmonary infarction will have a red color in contrast to some other infarction. Another example of infarction that is clinically important is bowel infarction. And also, especially in patients with diabetes, we can see infarction in extremities, and that is also known as gangrene. So these were the common examples of infarction that were clinically important. So now that we have mentioned some examples of infarction, now we will move on to the next point and discuss different causes of infarction. So the most common cause of infarction include thrombosis and embolism in arterial supply. Now I have two separate videos on thrombosis and embolism, and you can also watch those two videos afterwards to know some more information. But for the moment, what is thrombosis? It is the process of forming a thrombus. And what is a thrombus? Thrombus is a solid mass formed in uninterrupted cardiovascular system from the constituents of a streaming blood. Let me explain. So as you can see drawn in the upper image, this is a blood vessel. Drawn in blue are the lining epithelium of the blood vessel, so those are endothelium. And also inside you can see RBC drawn in red color. And also you can notice that here we can see a solid mass. It is formed in the uninterrupted cardiovascular system, and this mass is produced from the constituents of the streaming blood, and mainly it contains platelet. And this is a thrombus. And as you can see, what has happened beyond this thrombus, you can see so many red blood cells here, so much good blood supply, but beyond the thrombus you can see that there is diminished blood supply, which is known as ischemia, and that can result in infarction. So like I said, one of the most common causes of infarction was thrombosis in the artery. Similarly, embolism in the artery can also result in infarction. So what is embolism? Embolism is the process of formation of an emboli. And what is an emboli? Emboli is a solid, liquid or gaseous mass that is also produced from the constituent of streaming blood, but that goes away from the site of origin, goes into a distant site, and then that occludes that distant blood vessel. And that occlusion in the distal artery can also result in infarction. So these were the main two causes of infarction. And in your textbook you will also see some other less common causes of infarction, and they will include local vasospasm, that is, locally in some areas blood vessel may constrict, and whenever a blood vessel is constricting, that reduces the diameter of the lumen, and that results in diminished blood flow. So that is another cause, local vasospasm. Other causes of occlusion of artery that will later lead to infarction includes compression of the artery by a tumor. Say for example, a tumor can be present in the close vicinity of artery in a patient, and as the tumor grows, the tumor will compress the artery, and that will lead to occlusion and later infarction. Other less common causes of arterial occlusion that will later lead to infarction includes torsion of the artery that can happen in testicular torsion and also in bowel volvulus. There can be rupture of a blood vessel due to trauma, and that can also lead to infarction later on. The blood vessel can become entrapped in a hernial sac, and that can also later lead to infarction. And also sometimes there can be compression of the artery by edema fluid. Say for example, whenever there is anterior compartment syndrome, that is when there is increased amount of edema fluid present in the anterior compartment of the leg, that excess fluid compresses the vessels that used to supply the four major muscles of the anterior compartment of the leg. And those four muscles included tibialis anterior, extensor digitorum longus, extensor hallucis longus, and peroneus tertius. So that increased pressure will compress vessel that used to supply to these four muscles, and that will later result in infarction in these four muscles. The last cause of infarction that we will talk about is regarding venous occlusion. Now, I have already explained how an occluded vein can hamper the blood flow and result in ischemia and later in infarction. However, you have to remember that the common outcome of venous occlusion is congestion rather than infarction. Let me explain. Usually when a vein is occluded, what will happen? Some bypass channels rapidly open, and that improves the venous drainage, and so blood can move out from the vein through those bypass channels, and since blood is moving out, more blood can come in through the artery. So by the help of those bypass channel, venous drainage is improved despite of the fact that there was an occlusion in the vein. And since venous drainage is improved, so arterial blood inflow also gets improved, and that results in not infarction but congestion. So when will venous occlusion, say for example by a venous thrombus, will result in infarction? This is very important. This is very high yield information for your examinations. When can we see infarction due to venous occlusion? We will see that in those organs that has a single efferent vein. Say for example in the testis, in the ovary, they have only one efferent vein, and therefore they won't be able to use those bypass channel to channel those venous blood when that vein is occluded. So also remember that thing. that venous occlusion, the commonest outcome of venous occlusion is what? It's congestion, and it will result in infarction in those particular cases, in those organs that has only a single efferent vein. Say for example in the testis and in the ovary. So now that we have described the different causes of infarction, now we will move on and discuss the types of infarction. So as you can see, we can classify infarct according to its color, age, and presence or absence of infection. According to color, an infarct can be red or pale in color. So let's talk about red infarct first. What are the causes of red infarct? Red infarct can develop following venous occlusion. It can happen in loose and spongy tissue, say for example in the lungs, because in those tissue blood is allowed to accumulate in the zone of infarction. Red infarct can also happen in tissues that has dual blood supply. And now let me explain. And to explain that, you can see that I have drawn a simple diagrammatic image here on the far left of the board. So suppose this part of a tissue is supplied by dual circulation. So it is supplied from an artery and its branches that we can see on the top, and it's also supplied by another artery and its branch that we can see in the bottom. So what will happen if one of these arteries are occluded? So now less blood will flow into that tissue, and that will result in ischemia and later in infarction. However, also note that since the other blood vessel, the other artery or the other circulation is still unobstructed, so blood will do flow from the unobstructed circulation to the tissue, although they are not sufficient to meet the demand of the tissue. So that will result in infarction that will be red in color. So that is another example or another cause of red infarction. So like I said, red infarction can happen in tissues with dual blood supply. Red infarct can be also seen in tissue where there is congestion, and also it can be seen when blood flow is re-established in a vessel that was previously occluded. Say for example, suppose a vessel was previously occluded, and now with the help of angioplasty that occlusion has been removed, and so now blood is again flowing into areas where there was no blood flow previously. So that re-establishment of blood flow will also result in red infarct formation. The second type of infarct according to color was pale infarct, which is also known as white infarct. And this pale or white infarct usually occurs in solid organs that has end arterial circulation. Say for example, it can happen after arterial occlusion in the heart, in the kidney, and in the spleen. And the idea behind white infarct is in these solid organs, since the tissue is dense, it prevents seepage of blood from surrounding capillary bed to the site of infarction. Therefore, the infarction remains pale in color. Moving on to the next type of classification, and that was according to age. And according to age, an infarct can be fresh or old, and we will talk more about this when we discuss the morphology. The third way we can classify an infarct is according to presence or absence of infection. When an infarct is infected, that is known as septic infarct, and when there is no infection in the infarcted area, that is known as bland infarct. So what are the causes of septic infarction? One of the most common causes is when a vegetation from the heart valve that was infected, that is an infected vegetation from the heart valve, detach, and later that thing becomes an emboli, goes to a distant site and then blocks that distant circulation. and results in ischemia and infarction, and that infarction will be infected. Septic infarct can also develop when microbes seed necrotic tissue. And one thing you also have to remember, the septic infarct can later be converted into an abscess, and in this type of infarction we will see greater amount of inflammatory response as well. So now that we have talked about the different types of infarct, now we will move on and discuss the morphology of infarct. So always remember, infarct will be wedge shape. Now, what is a wedge shape? It is a triangular shape. It will have two ends. One end will be narrow and the other end will be broad. So it's sort of like a triangle. And when we talk about infarction, the apex of the wedge will be located at the site of occlusion. Let me explain. Suppose this is an artery, and this artery used to supply this triangular area of a tissue with the help of its branches. Now, if this artery is occluded here, this entire triangular area will become an site of ischemic necrosis, and that is an infarct. And as you can see, the apex of this infarct is pointing towards the site of the occluded blood vessel, and the periphery of the tissue has formed the base of the infarct. So this is wedge shape. Moving on to the topic of fresh and old infarct, I had previously said that I will talk about those things once we are in the morphology section. So initially the infarct will be poorly defined, and there will be slightly some features of hemorrhage in the area of infarction. But as the infarct becomes older, what will happen? It will become better, well-defined gradually, and that will happen as a result of presence of congestion around the margin of the infarct. And why will there be congestion along the margin of the infarct? That will be a result of inflammation. Always remember, whenever any tissue becomes ischemic, whenever there is diminished blood supply to that tissue, and whenever that tissue has suffered irreversible damage, that releases a lot of chemical mediator. Those injured cells of the tissue will release a lot of chemical mediators, and those chemical mediators will cause inflammation. They will attract neutrophil, they will attract other inflammatory cell, and then those cells will come out from the blood vessel and go to the site of injury and cause inflammation and congestion. So that is an important morphological feature that we will see in older infarct. So I'm repeating again, fresh infarct will be poorly defined and slightly hemorrhagic, whereas older infarct may have a well-defined margin as a result of congestion due to inflammation. Whenever we talk about the histological appearance of infarct, you have to remember that in most cases it will be that of coagulative necrosis. One exception will be in the nervous system. Infarction in the nervous system, in the central nervous system, will result in liquefactive necrosis. And I also have separate video about necrosis. You can also see cell injury part 2 video from my videos section to know more about those things. But now I will tell you an important thing that is often asked in the exam hall. The examiner may ask you, can you see these necrotic changes instantly? And don't fall for the trap. Although necrosis and these things are happening from quite an early stage, but those are happening initially at molecular level. So frank evidence of necrosis will be visible only after 4 to 12 hours. So always remember that it takes about 4 to 12 hours for frank evidence of necrosis to develop that can be visible under microscope. So always remember that thing. Same thing goes for the inflammation. Although the inflammatory cells will move in the margin of the infarcted area within a few hours, but they will be well defined and visible under microscope after a day or two usually. So it will take about a day or two to see well defined inflammation and congestion along the margin of the infarcted area. So now that we have discussed the morphology of an infarct briefly, now we will move on to the last topic and discuss the different factors that can influence an infarct. So there are several factors that can influence the development and extent of an infarct. The first one that we will talk about is the anatomy of the vascular supply. Say for example, if the area had dual blood supply, there will be less chance of infarction compared to area that has only end artery supply. Let me explain. The lungs has dual blood supply, the liver has dual blood supply. Say for example, it has supply by both hepatic artery as well as portal vein. Same thing goes for the hand and forearm that are supplied by both the radial and ulnar artery. So in these cases, there will be less chance of developing an infarction if one of the supplying blood vessel is occluded. Now compare that with organs that has end arterial circulation. Say for example the kidney, the spleen. So the kidney and spleen, since they have only end arterial circulation, they are more susceptible to infarction. The next factor that we will talk about is the rate of occlusion of the blood vessels. If the rate of occlusion was rapid, there will be more chance of infarction, and if the rate of occlusion was gradual, it will give time for collateral circulation to develop, and that will result in less chance of infarction. Say for example, we all know that the myocardium of our heart is supplied by coronary arteries, and normally the coronary artery there is small amount of interarteriolar anastomosis between the coronary arteries, but those small anastomosis have very minimum functionality in normal time. However, if one of the coronary artery slowly develops a blockade, gradually becomes occluded, that will give time during which those small collateral circulation can increase, and that will result in less chance of infarction despite the fact that one of the major coronary artery has been occluded gradually. The next factor is tissue vulnerability to hypoxia. Different tissue have different vulnerability to hypoxia. Say for example, the neuron will die within just 3 to 4 minutes if the blood supply has been deprived. The myocardial cell can survive up to 20 to 30 minutes, whereas the fibroblast can survive several hours in an ischemic condition. So all these things indicate that different tissues have different levels of vulnerability to hypoxia, and that will also influence the development and extent of an infarction. The last factor that we will talk about is hypoxemia. Hypoxemia means diminished amount of oxygen in the blood, and whenever there is diminished amount of oxygen in the blood, that will not only increase the chance of development of an infarction, but also increase the extent of the infarction as well. So this concludes today's video on infarction. I hope this video was helpful. If you like my videos, do subscribe, comment, share, and let me know. And for my students, I will also recommend you to go through your textbooks to know more information. So that's all for today. Until next time, take care and stay blessed. Thank you.